Alright, in this video we're going to talk about responding to an emergency. You've done all your preparedness, you've done all your training. Now something is happening in the real world and you need to be able to respond to it. That starts by using a procedure known as the National Incident Management System. This was created by FEMA, the Federal Emergency Management Agency, to allow different communities and different agencies to use a common approach. So this allows kind of cross-collaboration across agencies and across jurisdictions, with the ultimate goal to reduce loss of life, loss of property, and harm to the environment. So what this is, what the NIMS is, the NIMS, is really a set of concepts and principles that anybody preparing for an emergency should follow. The NIMS is not the response plan themselves. You use the concepts and the procedures of the NIMS to create your response plan, because response plans will differ based on whatever emergency you're discussing. It's also not a static system. It's not meant to be only used once and then put up on a shelf and only taken down during an emergency response situation. It's meant to be continually improved. It's meant to be implemented on a regular basis and to be constantly updated with the newest and best information. And really what the key thing of this does, what the key thing of the NIMS is that it incorporates all of those key elements that we discussed in a previous video into actionable items. So if you're going to train, how do you actually train? If you're going to make sure you have all these capabilities in place, how do you make sure you have these capabilities in place? And then how do you actually perform those capabilities, whether it's epidemiology, lab functioning, positioning, emergency services, evacuations? How do you actually do all of that in these response situations? The NIMS has 6 key parts to it. Part of it's command and management, then actually the preparedness process itself, having resources available to conduct the response, communications and informing and information management. This is both within the response team as well as in the community. All of the supporting technologies you're going to need, and this can be everything from making sure vehicles are in place, having internet systems in place and being able to have communication with people from in the office and in the field during an emergency, particularly when power is out. Cell service may be spotty at best, and even if it does work, it may be jammed with people trying to use their phones to get messages to loved ones out. And then again, the ongoing maintenance and management, constantly training, constantly updating your plans with the best available information. A key section of the NIMS, but not the only section, is the command structure. And that's created through what's known as the Incident Command System, the ICS. And the ICS is a standardized approach to organizing the response to an emergency situation. And this is very important because the key feature of it, and what may separate this type of system from what existed before, is that it designates a single person to manage and coordinate the emergency response. Whoever that person is, it's unlikely to be someone in a position of power, so it's not the president, it's not the governor, it's not a mayor. It could be someone in public health, it could be someone from emergency services, so fire, ambulance, police, it could be someone from the utility company. It doesn't matter who the person is. All that matters is that that person is trained to be the leader of an emergency response and knows how to make those quick decisions. And what they're doing is they're organizing and coordinating the response among multiple different agencies who may not always talk to each other. So you're talking organizing the center, the operations center themselves, where the leader and his team would be headquarters, working with emergency services, so fire, police, emergency medicine, working with local, state, and potentially federal public health agencies, the utility companies, other NGOs, so non-governmental organizations. So the Red Cross is typically the largest nonprofit here in the US that aids in emergency services, and then the transportation companies. So if you're in an area that has public transportation, has rail systems, has bus systems, how can you use those to aid your response, or how can you avoid them if they're going to actually hinder your response? When creating the incident command system, you're going to create some type of model like this. You're going to identify who's the commander, who's really in charge, who's your main officer, so who's giving information to the public, who's your essentially press officer, who's your safety officer, and who's actually your liaison between the center and all of these other agencies, who's your go-between. And then you're going to identify the key person in each of these other blocks. These are the different important parts of an incident command system and in the emergency response plan itself. So who's in charge of operations? Who's in charge of the people actually in the field? Who's in charge of planning, and who can we go to actually pull out the plan, the emergency plan, and talk about what needs to be done? Who sets up the logistics in terms of staffing as well as support and resources? How do we get those resources? How do we deploy them into the field? And then the finance side. Who gets the money? How is it tracked? Where is it going? How can we actually perform all of this so it can, withstand an audit and we know what the money is spent on? Often when we respond to an emergency, it's very local, it's short term. But we don't necessarily have, all local agencies don't necessarily have all of the supplies they need to respond to all emergencies. And it's really not feasible for that to happen. It would be cost prohibitive for every local health department and every state health department to buy enough supplies for an emergency situation which they may not actually encounter in our lifetimes. So in its place, we have what's called a strategic national stockpile. It's a national repository of pretty much anything we could need for an emergency situation. Everything from antibiotics, vaccines, antidotes, antitoxins, and other medical equipment we would need for essentially intensive care units if local hospitals can't handle the patient load. The idea behind this is that any of these supplies can be distributed to any part of the country, including Alaska, Hawaii, and all the island territories that are under U.S. control within 12 hours, so within a half a day. The one that I'm familiar with the Strategic National Stockpile is in response to pandemic influenza. When I was working on the emergency response plan for pandemic flu in Connecticut, we had to write in how we would use the Strategic National Stockpile because we would tap it for antiviral medications such as Tamiflu. And if there was an outbreak in Connecticut, we needed to make sure that there would be enough Tamiflu to get to Connecticut's population within that 12 hours. So it's a kind of a very difficult logistical situation to not only store enough stuff, to not only constantly update your storage, constantly buy new equipment because drugs and devices have expiration dates, but also to get it to different places, particularly remote places, within that 12-hour window. In addition within the Strategic National Stockpile, in addition to those vaccines and those antidotes and the antivirals I mentioned, we also have things known as chem packs. You don't have to know what's in a chem pack, that's not important. What is important is that they're intended to be distributed after a chemical attack. So if, for whatever reason, someone drops mustard gas, for instance, that's a very dangerous chemical that was used in World War I, onto a city, what needs to happen are these chem packs, which can help protect people from chemical exposures, need to be distributed to these major cities, to these potential target areas, in very rapid response. 12 hours would not be quick enough. It needs to be minutes, if possible. So on this map are all the chem pack locations. You'll see more of them in denser populations. You'll see them located around the big cities where you would expect it. And in very rural areas, you wouldn't actually have one of these. You wouldn't expect a chemical attack in the middle of the desert out west or in the middle of farms in the Midwest. You'd expect them in the large population centers. So the Strategic National Stockpile and these chem pack locations are located where the majority of the population is. So you're going to have more along the coast than you will have in the center of the country. You'll have more along the Mississippi River and the Great Lakes than you would have in other areas of the Midwest and the West, where it's really quite rural, where you don't have a lot of population density.